Hello, my name is Robert Pollock, and this is the evaluation reflection 3 over an upper extremity injury. The upper extremity injury that I am reflecting over is a shoulder reevaluation that I did on a volleyball player who had already been diagnosed with a SLAP lesion. This evaluation was a lot different than the majority of ones that I've done because it is this reevaluation piece. So in it, the main goals of the reevaluation were to assess manual muscle testing grades and range of motion grades to see if the treatment plan we were currently using is effective as it is or not. I didn't know a whole lot about the case before doing the evaluation, so a lot of the stuff that I went through was making sure I got the full picture of what's going on, what has been going on, what happened, when it happened, what did we do, stuff like that I talked to the patient about before doing the evaluation. So just getting that full history of everything that's happened so far and what we're doing now and how we're going to advance from there. So with this patient, she had received a SLAP injury from poor blocking mechanics. So she was up for a block, and just the force of the ball hitting her hand sent the shoulder back far enough to get this to occur. Originally, as a case, we thought it was rotator cuff strain or a deltoid strain, and we'd been treating it as a rehab like that. It progressed. We went for x-rays, we went for MRI. The physician looked at the MRI and gave us that it was a SLAP lesion. The patient was given the option to do surgery or not. She's choosing to wait till after the fall season to do surgery. So this case evaluation comes near the end of her spring volleyball season and after learning that it's a SLAP lesion and everything. So some of the main complaints she said at the time of the evaluation was that it seemed like the pain was it used to be in one spot, and now it was kind of a diffuse pain throughout the shoulder. She couldn't really pinpoint one spot that, yeah, this is where it hurts the most, or really anything. She kind of did one of these, it hurts all in here about equal. And that's pretty interesting because originally in the case she was able to pinpoint one spot exactly, and through time it's gotten worse and the patient has lost function pretty much. So this evaluation we went through, I made sure to do all the palpation and stuff. I treated it like a new case, but I also knew the diagnosis. So I treated it like one that I hadn't seen before. Did palpations, did my range of motion with a goniometer, which I feel like I've been improving a lot on. Then I did the manual muscle test for all the rotator cuff and some of the deltoid and biceps. Then went on to do some of the diagnostic tests for the labrum and some instability testing for the shoulder. My results were, on the diagnostic tests, were not indicative of a SLAP lesion. There was some apprehension with the anterior and relocation, so she probably has some sort of anterior instability, but other than that, there was not a whole lot that was indicative of the SLAP lesion other than the modified labral shear. So going through it all, got the same diagnosis, realized that the plan we have right now is not effective in relieving the patient's strength deficit, so increasing strength and range of motion or relieving patient pain. It's actually doing the opposite. It's gotten worse throughout time. So when talking with Emma, one of the main things we talked about was what we could do rehab-wise to get it better. Realized that there's probably not a whole lot that we're not already doing that's going to get it better. The surgery needs to be done, but the patient wants to wait till after season's over to do the surgery. So with that being said, then we went to, I wanted to know how the evaluation went, and she thought that, I was pretty good at being patient-centered, asking questions like, hey, when are you experiencing this pain? Does it bother you outside of the sport? And of course her answer was yes. Pretty much hurts her all the time, and washing hair is the worst, and stirring a pot. So cooking in general, she couldn't even really cook without having pain. Then the other thing that I asked about later in treatments and stuff was, how bad has it gotten on the global rate of change scale? And she reported, about a -4, which is pretty significant loss of function or loss of change, and a negative change for her. And then finally what we talked about was, you got the overall diagnostic right and the assessment of the treatment right, but if you were the clinician and didn't know that it was a SLAP lesion and didn't know that it had MRI, what would you have done? And we talked a little bit about that and going, yeah, I probably would have treated it. There's not a whole lot for a SLAP tear at all, so I probably would have treated it as instability caused by the muscle strain or muscle weakness. So I would have done a strengthening exercise and tried to do that. But like she said, part of the reason the ISU's policy is the way it is the 2 weeks and then refer, is because in the shoulder case, after 2 weeks, it's not gotten better. There's probably something else there that's causing that, and you need to get it investigated. One of the things that we talked about that probably wasn't the best was the organization of the eval. It seemed like I had the patient going from standing to sitting to standing to sitting to laying down pretty regularly. So now that clinicals are over and everything, and I have a whole summer to prepare, the goal for the summer is for me at least one Monday every 2 weeks to go through a shoulder eval. My brother's pretty cooperative in pretty much everything, so I can write up a case, tell him to do it, act it out, and then just go through how I'm going to have the patient do it, do the tests, and that'll serve as a good reminder of all the tests that I need to know and how to do everything. The other thing I can do is, if for some reason my brother doesn't want to do it, I can just, okay, here's this pathology for the shoulder, and this is again every Monday I do this. Here's this pathology for the shoulder. How am I going to go about the evaluation from observation to assessment to plan? What am I going to do for this patient to get the diagnosis, and then what am I going to do after to try and do this rehab piece? The other thing that I struggle with at times is the knowing all of the pathologies of the shoulder. So one of my goals for the summer is that I'm going to sit down at least once a week and read a case report about some shoulder pathology that I decide that week. So maybe one day it's SLAP, one day it's a Bankart, maybe it's a impingement, but just learning as much as I can about these cases so that I can apply it to my clinical use. And then with that being said, after reading this case report, I want to make sure I can remember things, so I want to write 1 to 3 things that are take-home points for me that I'm going to use when I get back to campus in the fall. The final thing that we talked about is, and Emma was very understanding because she knows I haven't had rehab yet, but just getting that rehab plan. So one of the things that I'm already going to be doing because of an honors project is reaching out to Dr. Gavin about rehab. I really wanted to send me about 5 to 6 articles before I start my rehab class so I can work on this honors project, but I also want to learn as much about the rehab process and things that work, things that don't work. Again, with that, I want to do, if it's over the summer, at least one every 2 weeks, read an article about rehab, write 3 take-home points that, hey, this is what I'm going to do. And then, because my family's pretty incident prone, I can actually install the rehab plan with my family and see, okay, this works, okay, this doesn't work, okay, maybe I need to go about it this way to cue the patient. So with that being said, I know that piece won't necessarily be in there, but I really want to be reading as much as I can about pathologies, rehab, and then organizing an eval for a shoulder that is pretty muddy and sometimes doesn't give you the best information. The final thing is that, and I've been thinking about this the past couple of days, is I really don't know how to call a physician and talk to them face to face or on the phone and order x-rays, or order whatever I need for my patient. So one of the things that I'm going to talk to either Dr. Armstrong or Dr. Gavin about is, hey, is it okay in the summer I make up a case and call you, and this is how to order and practice how to order these x-rays, evals, because once I graduate in 2 years, it's going to be a whole lot different. It's going to be me calling and not Emma or whoever my preceptor is calling. And I just want to make sure that I have that done. So that'll probably be, if they're okay with it, it'll be once a month. So June and July, I'll call one time and, hey, and run through what I would say to a physician about ordering these evals and ordering the x-rays and communicating what I did and why I think they're needed. That has been the evaluation reflection for the upper extremity injury, i.e. the shoulder. I look forward to taking these goals and points and becoming a better clinician with them. Thank you. Have a great summer.